Okay, thank you, everyone. Now let me introduce our speakers for today. We have Orion. He uses he, him pronouns. He's a Spring member and currently working with hospital workers. We have Kaitlin, who is also a Spring member and a policy analyst with early childhood educators. Before I hand over the mic to our speakers, I'll just explain how the meeting will work today. The speakers will go for a total of 30 minutes. Then we will have questions and comments from the audience. The speakers will respond to your questions and comments at the end in their concluding remarks. If you'd like to speak, please raise your hand and I'll add you to the speakers list. I'll be using an equity speakers list, which means I may not call on you in the sequence you raise your hands, but will prioritize Indigenous, Black, comrades of color, women, and first-time speakers. Questions and comments are welcome, but please try to keep your contributions to 3 minutes. This will allow for more contributions during the discussion. Finally, we encourage you to post on social media throughout the conference today to share your thoughts and experiences. Please use the hashtag RedOctober2025. You can tag Spring on all platforms using @SpringMag.ca. Okay, so now I'm going to hand it over to our speakers.
Thank you, Maureen. Sorry. Hi, everyone. It's very cool to be here with you all. I'll jump in to just start defining universality to start us talking. So when we're talking about universality, we're talking about a principle that a social program should be accessible to everyone with no eligibility requirements or as few as possible, and that everyone's getting the same level of service or support.
Awesome, thanks. And hi, I'm Kaitlin again. And let me know if I'm not speaking loud enough, even with the mic. So in Canada, when we think of our public healthcare system as our flagship universal social program, that is in principle supposed to be universal. And everyone in Canada is supposed to be able to access it for free. And whether you're rich or poor, you access the same system in theory, and you get the same quality of care.
And for me, tell me if I'm yelling into the microphone, because I get loud. And so, like, we can contrast universality to social programs that are means-tested or two-tiered. And a means-tested program is where most of us don't actually directly benefit from the program. It's targeted to people in need, and you have to apply and demonstrate that you meet the definition of in need to receive the support or access the social program.
So, for example, the New Canadian Dental Care Plan is an example of a means-tested program. So coverage is dependent on your household earnings. So we know now it's projected to help around 8 million people who didn't have dental coverage before, which is great, but many will still face copays of up to 60%, and about 4 million uninsured people won't qualify at all, which is not good. For those of us with employer coverage, nothing really changes, and our coverage comes at the expense of potentially lower wages or other benefits. And part of that cost goes towards insurance company profits. So even then, and even with that coverage, our plans often don't cover all of the care that we actually need. So it's not necessarily, in this sense, the perfect system.
Thanks, Kaitlin. And then a two-tiered program is one where there's an accessible government program, but if you've got the money, you can pay for a faster or better quality of service by going to a for-profit company in the private sector. And in Canada, aspects of our healthcare system aren't technically two-tier because it's illegal. Like, providers aren't allowed to bill you privately for what they could bill OHIP, but they can still end up being two-tier in practice. So, like, if you think of long-term care, the government funds medically necessary care in accordance with the Canada Health Act, and supposedly enforces equal standards for those medically necessary services. But you're left to pay for your own room and board and other services that go with that. And since your living conditions in long-term care are basically inseparable from your health conditions, you're going to have a much better health outcome if you're able to pay for a high-end home. And a high-end home, I don't know if we get into this later, but it's not the big for-profit chain homes, right? Okay, Kaitlin.
But so let me ask you then, Orion, because when we think about it, what is so wrong with like a means-tested or two-tier program? Like, isn't it like a more efficient, better use, a fair use of government resources, and it's more equitable if we actually just target people most in need rather than giving it to everybody?
That is such an excellent question, Kaitlin. I wasn't expecting you to ask that at all. But really, like, why should we waste our limited, money on rich people? But then history actually bears out that the more universal programs actually end up benefiting those who need them most more than more targeted ones. And we could sort of like simplify that down to like for two main reasons. So one is that means-tested programs impose barriers to access and can result in stigma for those who use the program. So there's lots of academic studies showing that often only a small portion of people eligible for the program even apply for it, let alone receive it. And then second, and I think we'll spend more time talking about this, is that since more universal programs benefit more people, they're more politically popular. And so politicians have a much more difficult time cutting their funding, at least explicitly. And then in contrast, there's a smaller group of impacted people who could mobilize and organize and advocate to defend a targeted program. And that group is also more vulnerable to being basically demonized as undeserving by those people who aren't benefiting from that system. You can look at the U.S., which relies heavily on means-tested programs, versus the classically Scandinavian countries built more universal systems that everyone could access. You'd think, okay, well, the U.S. programs must be more generous to poor people because they aren't wasting money on the rich. But of course, it's the opposite, right? The more universal programs tend to invest more overall. They offer more generous benefits, and so they do a better job reducing poverty. And then looking at the U.S. again, their more universal social programs like Medicare and Medicaid are the most politically popular, and millions of people have rallied against cuts to those programs when governments tried to do that. And just a side note, like Medicaid is technically means tested, but its threshold is so high that 1 in 5 people in the U.S. are enrolled in it. So it has this large impact, even though there is a means tested threshold. So when politicians are saying they don't want to waste public money on the rich, who they're really trying to exclude is like middle and upper income workers. And those workers are crucial to maintaining broad political support for social programs. When they benefit too, they're more likely to defend and expand those programs. When they don't, they tend to ignore them, or worse, support cutting them in the name of tax cuts that they think will help with how they're struggling to get along. And then, of course, the irony is that the politicians who claim that we shouldn't be giving money to the wealthy to justify, and they say that when they're replacing universal programs with means-tested ones, they're the same politicians who are actually giving the most money to the wealthy by cutting taxes on higher incomes and making our tax system less progressive. So the real way to make the rich pay their fair share is through a progressive tax system where higher incomes pay higher taxes, not through means testing or two-tier programs.
Thanks, Orion. I think this reveals a really important insight.
Oh, what's that?
That the history of all hitherto existing welfare states is actually the history of class struggle.
Of course. So governments aren't neutral technocrats just figuring out how to optimize their limited resources for our social well-being. You're saying that how much money governments have and where they spend it is impacted by politics.
And we know that as long as our society relies on a capitalist system, then how much social welfare we can extract from our governments is limited.
How come?
In a capitalist system, social welfare can never be too generous for 3 key reasons. So the first is that capitalism depends on the threat of poverty to keep people working, right? A strong safety net weakens that leverage to force people into paid wage labor. Second, capitalism thrives on turning basic needs into commodities. When essentials like housing or healthcare are public goods, they can't be used for profit. And third, government spending is limited by pressure from wealthy investors and corporations who resist raising taxes while demanding subsidies to protect their profits.
Thank you, Kaitlin. I see that. So that's why it's so important that social programs be politically resilient, because we know they're going to be attacked. And the more universal programs are more politically resilient. Okay.
Yes, and universal programs are also better from a socialist perspective as well, because they do more to unify workers and reduce corporate power.
Wait a minute. So you're saying they're not just better at softening capitalism's negative impacts on people, they also put us in a better position to abolish capitalism altogether?
Yes. More universal programs that a major part of the population directly benefit from help people see the program as a social right that everyone should enjoy equally, regardless of their income.
I guess it's hard to see yourself as an undeserving freeloader.
Right. When a universal program is attacked, it's easier for people to see who's really behind the underfunding, behind the curtain, right? Which is corporate power. That forces government to hide cuts through blame shifting, like federal and provincial finger pointing. It also helps build class consciousness, making it easier to confront other divisions within the working class, like racism and transphobia. The problem is means-tested programs divide workers. They divide us. Those who benefit from them versus those who pay for them through taxes but then don't necessarily qualify. When these programs are attacked, it's easier for people to buy into that right-wing narrative that paint recipients as freeloaders or undeserving, and this then further fuels resentment and racism.
So more universal programs help unite the working class. More targeted programs divide the working class by drawing a dividing line along a certain income threshold. And that division by income can amplify divisions based on oppression.
Yes.
So that's making me think about how in the U.S., we're seeing it right now. The right wing is able to fearmonger about trans people and migrants accessing healthcare funding, and that's undermining class consciousness, lets corporate power off the hook, and it's allowing for government to cut healthcare funding for everyone. And in contrast, in Canada, while the right is definitely stirring anti-migrant and transphobic sentiment, healthcare hasn't been as divisive a flashpoint as in the U.S. Like the anti-migrant views focus more on competition over resources that capitalism makes scarce for us, like housing and jobs. And while there's definitely transphobia being fueled around gender-affirming care, because there isn't the added layer around around access to healthcare being a scarce resource. So in the U.S. System, you can see the public money going to someone else's care as them getting something that you don't get and resent that. Whereas in our universal system, everyone's supposed to be able to get the care they need for free. So someone else accessing care doesn't mean less care for me or them getting something I'm not getting.
Yeah, exactly. And unfortunately, we can foresee those that type of resentment starting to increase in Canada, right? As underfunding and privatization shrink access to public health care, more workers end up paying through taxes without necessarily benefiting. If this continues, solidarity around healthcare could easily erode, and that anger could easily turn migrants in ERs or doctors' offices into scapegoats, right? Even though in reality, non-residents and undocumented people are already largely excluded from the healthcare system.
Which is why there's the Healthcare for All campaign, there's a sheet around. Okay, I see how more universal programs unify workers. How do they reduce corporate power?
So universal programs tend to shrink the private sector by having government either provide those services directly or by imposing strict criteria and accountability on non-governmental providers. In contrast, targeted programs often expand the private sector as commercial operators can step in to serve those excluded by means testing. So childcare has historically been a great example of that, right? If you don't qualify for a subsidy, I mean, we've got some for-profit providers who can provide care for you, but you have to pay market rates. And as well as, and then those for-profit providers can also then be very willing to receive that subsidy in a means-tested system as well. So, and again, just this is the case in childcare. And we can see that right now, especially the way that for-profit operators are trying to leverage their power on government to turn the system into what they want to turn it into. And so what this has meant is that, they use their weight, they use their bulk, and what they're trying to do right now is to get the government to loosen rules on public funding, and basically they'd like to completely disband $10 a day childcare as it currently exists. They want a subsidy system. So what they can do is then take that subsidy, use it however they want, and then remove all fee caps, so you pay whatever they want you to pay, and then they use your fee up to whatever they want to towards, which is largely like profit making, rather than quality of care for your kid, which is obviously a huge issue. And this is why advocates have been calling to exclude for-profit operators from $10 a day childcare, in part, not just because they are crappier providers, we already have the research on that, but in part to limit their ability to lobby government and sway public opinion against universal childcare. Because you have to remember, like, if they provide childcare, they have access to you as parents and citizens, and they can try to use that connection with you to sway your opinion and sway your political opinion as well.
Thank you, Kaitlin. Really good example. It's pretty clear that if we want a fair, accessible childcare system, we have to reduce the footprint of for-profit operators. The fewer of them there are, the less influence they have to reshape the system in their own interest, and the stronger our public childcare system becomes. Okay, I think we've sort of talked about, defining universality and why universal programs are more effective and more strategic. Let's move into talking about current issues and struggles in healthcare and childcare in Ontario. Maybe, Kaitlin, can you start by telling me more about the current state of childcare in Ontario?
Definitely, Orion. This is my wheelhouse. So yes. Okay. So if you do have, for example, kids and you're lucky enough to find a spot in like a subsidized space, under $10 a day childcare, like you will have then firsthand experience some of the benefits of this system. It is amazing. It's a historical milestone, and which is fantastic. But the thing is, it's not a silver bullet, especially as the system currently exists. There are still some huge challenges we need to address in $10 a day childcare if we want this program to truly work for everyone. Accessibility, of course, is still a huge issue. Many families still, and maybe you are one of those families, coming from one of those families or households, especially, who just don't have access to $10 a day childcare, especially people living in remote, rural, or low-income areas. And we also know that, families with children with special unique needs are also disproportionately likely to not have access to a space. This is the number one reason for this is we simply don't have enough qualified workers to staff these spaces. So beyond the conversation around like brick and mortar physical spaces to house children, it's a lot about is the qualified staff. Registered early childhood educators are a licensed profession in Ontario, which is unlike any other province or territory in the country. You need to have at minimum a 2-year college diploma in early childhood education or its deemed equivalent. And we simply don't have enough of those people to do that job, considering they're paid basically under the poverty line in any city. And so this is a huge issue for expanding access to childcare.
That resonates with something I'm going to say about healthcare later. But right now it sounds like marginalized families, especially racialized and Indigenous families, are more likely to face accessibility issues since they're more likely to live in these underserved areas. Right?
Yes, yeah, astute. Yes, and the thing is, these same families who don't have access also struggle, like as a result, they're less able to access high quality care as well, because as a result, if you can't find a space in a licensed care center, you're going to be more likely to rely on unlicensed home-based care, which, they meet far fewer like health and safety requirements. Basically, it's just ratios and some requirements around physical space, but it's not the same level of quality as you're going to get in a licensed childcare center. And then even families who can access these licensed care centers are not necessarily guaranteed high quality care because for-profit providers are growing in the province. And these providers are more likely to rely on unqualified staff because centers can do that. They're called director's approvals, where you get special permission to hire an unqualified person to basically provide the same type of care, supposedly, to your child. And the reason they do this is because they can't attract qualified staff is because they're not willing to pay the same wages as not-for-profit and public centers. And so the result is less quality care for your child for people who aren't trained in, proper pedagogy, child-based, play-based learning. They don't know any of that because they don't have the training to do any of that, and that does directly affect quality of care.
And so, right, and so when we're considering that quality, I guess we're talking about going beyond just ensuring children are safe and well fed.
No, definitely. And equity and inclusion are a huge part of this as well. A truly universal system needs to meet everyone's needs, not just those of able-bodied children or children from dominant cultural groups. For example, we know there's a huge shortage of Indigenous-led childcare, especially in urban areas. Educators need support for culturally appropriate practices, including land-based learning, of which there are often bylaws against centers being able to practice properly. And then we do also need a curriculum update to center equity and inclusion. And there was a study, and that's not to say too, a lot of practitioners, like RECs, do want to practice more inclusive forms of pedagogy, but we do know that sometimes educators may struggle to practice themselves. There was a recent study out of George Brown College that noted that a lot of educators really were hesitant to teach about LGBTQ plus families, which is obviously a huge issue. So we need a curriculum update as well, and ongoing professional development to support that type of inclusive pedagogy.
So how do we solve these issues? Is it an easy and obvious fix?
I feel like for a lot of things, it's money. Yeah. But right now, yeah. So the thing is, it is money. Really comes down to a lot of it is not enough funding. And there was a report recently out from the Ontario Auditor General, $2 billion funding shortfall. Ontario is not keeping up with federal support for this program. And so we need that money because, again, talking about a workforce strategy, we need money for a workforce strategy. That's basically what it's for. We can't attract and retain qualified workers if we don't pay them properly. And that's not just wages. That's also a pension, benefits. You want someone to stay in the sector, you need to create a career pathway for them. And this is going to be incredibly important, especially for expanding childcare to marginalized households. The government also needs to start funding startup costs for not-for-profit childcare centers, because right now, it's a lot easier for for-profit centers to get a loan out from a bank because they're seen as financially viable in a way that not-for-profits are not. And so things loans from the municipalities or startup grants to expand physical infrastructure are things that we need to ensure that for-profit doesn't completely take over in this province.
So we need to make the province commit more money, and we also need to make sure that money isn't going to for-profit providers like we talked about.
Yes. Yeah, no, definitely. That's ideally for-profit operators should be completely ineligible for public funding, obviously. And the government should take a more active role, even beyond that though. Not-for-profits are great, but ideally the government should also take a more active role in planning, establishing, and operating childcare centers based on actually community needs. We know the best childcare centers are publicly run childcare centers, right? That's where the best wages are, the highest quality care. But the problem is the government likes to rely on the third sector, aka for-profit and not-for-profit operators, to set up wherever they see fit. And guess what? These centers don't often setting up in rural, remote areas because it's just the household. Oftentimes households don't have that necessary supplemental income, or it's just, more work, right? Rather than establishing in a high-income urban area or something like that. So we need municipalities to start planning for and be emboldened to and have the funding to plan for these types of spaces, and based on community need, right? So if the community the municipalities know that there are a lot of shift workers in their community, then they should ensure that there are publicly run centers that provide extended hour care for parents, right? Because right now, actually, in fact, a lot of people work precariously, but most centers actually only provide basically the equivalent of an office worker's schedule care, 8 to 4 or 8 to 5 or something like that. And that just doesn't meet people's needs, right?
Well, speaking of meeting local needs, how can we ensure that our public childcare system is truly inclusive and equitable?
Good question. True inclusion means shifting power. It's not just adding cultural elements. Governments must genuinely share authority with marginalized communities in shaping the childcare system, especially urban Indigenous communities who should have just greater control over the childcare centers, which they just currently do not. We also need to ensure that like that, these programs, early learning programs, they actually reflect the value, languages, and traditions of the communities that they're immersed in. And also this means inclusive training for RACEs, who are tasked with providing this type of care. And so, I mean, there's a larger question about, because a lot of people are now getting education through career colleges, which are for-profit colleges in the province, which provide relatively shitty care, if I can like say that off the record based on like the job that I do, but it is largely true. They are not getting as high quality care, and then these people are coming to the community and taking care of your child. So that's going to be a huge issue. So in addition to excluding for-profit childcare operators, we need to seriously consider excluding for-profit career colleges as well, who are preparing the workers of tomorrow.
Okay, thank you, Kaitlin. I am really seeing and feeling like this is an important and exciting moment for socialists to contribute to cementing public childcare and making it as truly universal as possible. Thank you.
No, my pleasure. So, Orion, now will you tell us about the current attacks on universal public health care in Ontario?
I will. We probably have a lot of direct experience with the current issues in healthcare in this room. I think we are sort of familiar that government after government lets access to quality care erode and then presents privatization as the solution to that. And in Ontario, Doug Ford is accelerating this, right? So just like some standout facts that like illustrating the erosion of access to quality care. So the number of people with access to reliable primary care is expected to double in the next 2 years. A lot of emergency rooms have started closing for days at a time due to lack of staff. Hallway medicine has increased 25% under Ford. Healthcare workers' real wages continue to go down. And, you know, aside from the pandemic blip, Doug Ford has been cutting hospital funding by funding it below the rate of inflation. And so the results are a struggling healthcare workers and worse quality of care and worse and access to timely care. And sort of like you were referencing earlier, like if this trend continues, it can create a de facto two-tier system. When people can't access healthcare, it's not universal in practice, even if it's universal in paper, and more people will find the means to bypass that broken system, and those without the means will be stuck in suffering and ill health. And then like what we talked about before, the more that's the case, the more vulnerable universal healthcare is, period, to just complete dismantling. So then like talking about privatization, Ford, like according to the Ontario Health Coalition, Ford is shifting more than $1 billion a year of that underfunding that's already happening away from nonprofit hospitals and to for-profit clinics and temporary staffing agencies instead. And when Ford's doing that, there's a few myths that I thought I just touch on that he taps into when he's sort of justifying doing that. So he claims that private clinics will increase the healthcare system's capacity and so reduce wait times. But they don't, right? Ontario isn't short on healthcare infrastructure, sort of like what you're talking about with childcare, especially in urban centers where the for-profit clinics typically set up, similar to the for-profit childcare operators. There's lots of operating rooms in hospitals that are underused, other like hospital infrastructure that's underused. What Ontario lacks is healthcare workers, and for-profit clinics don't create a single new staff person, right? Public universities do that. And actually, it's worse than that. Private clinics actually take health workers out of the local, public hospitals, making shortages worse and leaving the public hospitals to deal with the more costly and complex patients.
So just to provide a gist of what you said, so Doug Ford is basically using our healthcare dollars to fund unnecessary new for-profit builds in regions we don't need that will steal much-needed workers from the underpaid public system.
That's right. Another myth Ford uses when he's doing that is when he's pushing privatization is that it's still public health care, even if it's delivered by for-profit companies, because you'll pay with your OHIP card, not your credit card. But that's not true just like fully on its face. Like for-profit clinics often find ways of upselling patients and extra billing, sometimes completely legally, and the province is not cracking down on that. And if you're looking for like facts and resources on that, like the Ontario Health Coalition is like really on that, and you can find those resources there quite easily. And sort of like a telling study is, so Ontario took a bunch of cataract surgeries out of the nonprofit hospitals, gave them to for-profit clinics, and the total number of cataract surgeries performed actually declined overall, but went up for high-income people. So you can see that the profit motive is already resulting in a more two-tier system in practice already, right? So then Ford also claims that funding for-profit delivery is somehow a more efficient use of government funds, but the funding agreements Ford is entering into with for-profit delivery actually pay way more per procedure than the same at a nonprofit hospital, and the for-profit care is actually worse than the nonprofit care. So so much so that it actually like causes excess deaths, and there's studies on that are also, you can find them at the Ontario Health Coalition, but an Ontario example is of the for-profit cost cutting leading to risky practices is that, a private clinic in Ottawa, almost 7,000 patients were potentially exposed to HIV and hepatitis contamination because of faulty sterilization. So yeah.
Wow. Yeah. Yeah, that's a pretty horrifying statistic. And I just wonder too, like recognizing how devastating it can be for the average person when governments decide to dismantle, defund, and deregulate universal services like healthcare. I would wonder too, it's essential that we figure out how to effectively counter government talking points, trying to convince the public that, hey, this is actually a great idea. Big welfare states are unfair, they're inefficient, and a waste of taxpayers' dollars, all as subterfuge to move forward these kind of heinous acts. And so I wanted to note, it's worth noting that those who do want to dismantle universal programs rarely say so outright. And so instead, often too, what we see as well is like conservative politicians and right-wing groups often use very coded language that I'm sure everyone here has recognized in the media to disguise their intentions because they know it would actually be unpopular if they just said what they were going to do. And so recognizing these rhetorical tricks, it's going to be key to avoiding being misled into supporting policies that quietly erode public welfare systems. And so I think like a really good example was from the last federal election when Pierre Poilievre was asked, what are you going to do about $10 a day childcare? Are you going to dismantle it? Because it kind of seems like you're going to dismantle it. And he'd never say, obviously, like, definitely that's the plan, right? He avoided answering whether his government would keep it or not. He just kept saying, the system's failing, and I'm going to give you something that provides more flexibility. I'm going to provide you something that provides you with more choice. And that sounds like a great thing, right? Who doesn't like more choice in their life? And the problem is that it's really just code for privatization. And it's a way to justify shifting public services into private hands under the guise of empowerment. In reality, the choice is never really a real choice, and it usually means you have the choice between choosing between, like a low-quality, unlicensed childcare provider that's potentially not very even safe, and a somewhat moderate or like better quality but extremely expensive commercial provider. And that's just kind of the choice you're left with as a group of people who obviously does not have unlimited funds to spend on like quote unquote like luxury style childcare. And this is like inevitable as governments pull back and commercial operators move in.
Yeah, and there's like, I think this underscores, that there's the power of the universal programs, but so politicians have to find subterfuge to attack them. And it's making me think of how when Mike Harris justified drastically reducing the number of hospital beds in Ontario, of course he couldn't just do that outright. He claims he's making up for that by creating more long-term care beds, which is supposedly going to be more efficient use of public funds. There's a grain of truth to that, but what he actually did is bring in corporate, for-profit, long-term care homes in Ontario, based our long-term care system around publicly funding their profits while they reduced quality of care and working conditions with horrifying, consequences making headlines during the pandemic.
Yeah. And like that's a great point. And like beyond that too, like even thinking about like the words that politicians use, they're often supported in this by like the efforts of for-profit lobby groups who have so much to gain from, welfare dismantlement. And so I think like a good example too, when we think about beyond like even the use of buzzwords around flexibility and choice, I know especially within the childcare space, there is a for-profit lobby group called the Canadian Coalition of Childcare Operators, which I mean doesn't sound like it's a pretty benign like front name, but it's they are specifically a lobby group for-profit centers that want to replace the national childcare system with subsidies. And the thing is, they don't say that. Like they don't say that. And you can often, like they were in the media like a little while ago. What they were threatening to go out on strike over, like issues around quality, which really that was not the case. But the language that they use centers, if you go on their YouTube channel, they talk about equity and inclusion to argue that the current system's just not fair. And it's a really clever tactic. And if you go to their YouTube channel, you'll even see like quote unquote like high quality video content talking about feminism. They've interviewed a former NDP MPP. So I mean, really, like even if you're so like a progressive, you would initially on like a surface level have a really hard time decoding their message. You might be like, these people sound great. Like, they care about me, they care about my kids, they care about inclusion. And what they do is then they confuse the public and you're like, maybe this system isn't a good system, right? But when you read between the lines, it's clear that their real goal is to avoid any kind of accountability for how they use public funds. And so they just want to open the door for more privatization. They want subsidies so they can take public money and use it whatever way they want. So they'll talk about inclusion and, outdoor learning. They can't do this under the current system. There's too much accountability, too much red tape. But really, it's just like they're angry that the government's now currently placing restrictions on how they get to use money and how they can't divert more of it towards profit making. And so that's a big issue. And we have to be able to decode that language, and it can be very difficult to do so.
Thank you. Yeah, well, we could be done now, actually. Anyway, they make me so angry. Let's go to the discussion.
Thank you so much. It was a really great discussion.